Will genetic testing replace muscle biopsy for muscular dystrophy diagnosis? The question of whether genetic testing will replace muscle biopsy for diagnosing muscular dystrophy is a hot topic in the medical community. Genetic testing is becoming the main method for diagnosing these conditions, but it has not completely taken over from muscle biopsy. Genetic testing is favored because it can accurately identify specific gene mutations responsible for different types of muscular dystrophy. This method is less invasive than muscle biopsy, which involves taking a sample of muscle tissue. Muscular dystrophies are genetic disorders that lead to muscle weakness and degeneration. They are caused by mutations in genes that encode muscle proteins. Genetic testing analyzes a patient's DNA to find these mutations, such as the dystrophin gene mutation in Duchenne muscular dystrophy. With advancements in genetic sequencing, doctors can now identify mutations quickly and accurately, often providing a diagnosis without needing invasive procedures. On the other hand, muscle biopsy has traditionally been used to confirm a diagnosis by examining muscle tissue under a microscope. This procedure can reveal changes in muscle structure and protein expression. It can show if specific muscle proteins are absent or reduced, giving insights into the severity and type of the disease. However, muscle biopsy is invasive and can be uncomfortable for patients. Current clinical guidelines state that a diagnosis of muscular dystrophy can be confirmed through either genetic testing or muscle biopsy findings when genetic results are unclear. This dual approach helps ensure accurate diagnosis and informs treatment decisions. For instance, in Duchenne muscular dystrophy, genetic testing is often the first step, but muscle biopsy may still be necessary if the genetic tests do not provide clear results. In summary, while genetic testing is rapidly becoming the preferred method for diagnosing muscular dystrophy due to its non-invasive nature, muscle biopsy still plays a crucial role in certain situations. The two methods work together rather than replace each other. As genetic technologies improve and more gene panels are developed, the reliance on muscle biopsy may decrease. However, both methods currently contribute to a comprehensive diagnosis of muscular dystrophy. Patients and clinicians benefit from the shift towards genetic testing because it allows for earlier and less invasive diagnoses. This can lead to timely interventions and genetic counseling. Nevertheless, muscle biopsy remains important for understanding muscle pathology that genetic tests may not fully reveal. It is essential for patients to consult healthcare professionals to determine the best diagnostic approach for their individual situations.